Liz from HealthWorks Collective, and I'm here today with Ivana Schnur, MD, PhD, and co-founder and chief medical officer at Sensely. Dr. Schnur has a background in behavioral medicine, virtual reality, and clinical artificial intelligence. Sensely's developed what they call a remote assessment hub using speech recognition, augmented reality, and medical devices. A nurse avatar quickly assesses a patient's condition and relays it to the provider. Sensely is available on mobile, web, and TV. Dr. Schnur, tell us a little bit about your background and about how Sensely got started and how it works.
Well, thank you, Joan. I am a medical doctor as well as clinical psychologist. Most of my research I focused on medical compliance and quality of life. And when I met some of my mentors that were really into virtual reality and tools that would help patients to increase their quality of life, I got a little sidetracked into how the technology can really be an assistant and help in the medical arena, and that's how Sensely got started. The reason we founded Sensely was my co-founder Adam Modeski was to really look at the problem of medical compliance and motivation in chronic care. A lot of the diseases that are chronic in nature, the most difficult issue is to keep with the medical protocol, and Sensely allows you to not only follow through with what doctor ordered, but also motivates you and keeps you up to date. It also has the capacity to alert you if something is not quite right or alert your clinician.
Okay, and how exactly does it work? How exactly does it work? It's an avatar, correct?
It's an avatar, and it's much more than an avatar. So it is a platform that is mobile and based on in a cloud. What the doctor does is when you discharge from the hospital, it enters the protocol and what they want to follow. So it could be your blood sugar, it could be the days of your sobriety or emotional status, and that creates a dialogue. The platform creates a dialogue that the nurse avatar or your coach or your friend or buddy then delivers to you via smartphone or a TV or a tablet or just a computer, asks you what they need to know. We also have a capacity to then for the avatar to do exercises with you if that's what you need.
Oh, really?
And then via Bluetooth, it kind of gathers the information from home-based diagnostics, so the glucose monitor or the Kinect or just the interview, and maps it into graphs, alerts you if something is not quite right or alerts your clinician.
Okay, and Ivana, how does Sensely improve outcomes and reduce costs?
So Sensely's main focus is medical compliance, and medical compliance with the post-discharge or chronic management regimen is directly correlated with cost saving in a medical arena. It is the non-compliance with what doctor prescribed that usually leads the patient to emergency visits or readmissions or exacerbation of their care, be it diabetes or badly rehabilitated knee or relapse in addiction. All this can be prevented or at least helped by the compliance that Sensely will help you with. So the fact that it can follow you, it can show you what the direct impact of your non-compliance is on your condition. It can also alert the clinician when you're right at the moment when you are non-compliant, and the clinician has the capacity to immediately either contact you or tweak the regimen. That is what really saves them time and money, because you don't then get readmitted or the patient doesn't get readmitted with much worse condition.
Yeah, I see. You can check in daily with this nurse avatar, and if something comes up, your provider can be alerted and you can take care of it.
Right.
That's great.
So not only that the provider will be alerted, but we can actually talk with each other. So I, as a doctor, can talk to you the same way as we are talking now, or with the nurse, and take care of the things that can be taken care of via telemedicine and save the rest for the face-to-face visit.
It's great. And what has the feedback been so far? You've been doing some pilots, correct?
Yes, that's correct. We have 2 pilots ongoing right now, one in San Mateo Medical Center, where patients are using Sensely for a rehabilitation after a knee surgery and shoulder surgery. Rehabilitation is a very long process, and most of us that had the experience are sent home with a sheet of paper with the stickman exercises on them. And even if we are the type of people that are very compliant and do those exercises, there's no guarantee that you're not over-exercising or under-exercising and therefore creating more damage. So what Sensely does, because it has the capacity to hook in with the Kinect, it makes sure that you're doing your shoulder and knee exercises just right.
Okay, it does them along with you?
Yes, it does them along with you and talks to you and, again, helps with the motivation. The feedback so far has been really very encouraging, but we are cautious because we don't have the data or analyzed. The qualitative feedback, the patients love the fact that they don't do it just by themselves, that the avatar can do it with them, and that they know that they're doing it right.
Yeah.
And then we have another pilot with in Santa Cruz in an addiction agency where Sensely is really helping some of their patients to stay compliant, and with some of the less fortunate ones that end up in a local Santa Cruz jail, it allows them to continue their mental care with their provider even while they're behind bars.
Yeah, thank you so much, Dr. Schnur, for joining us and telling us more about this really interesting product. I would definitely use it. I think it sounds great. And you launched today, correct?
Yes, we are.
Okay, well, congratulations, and thank you so much.
Thank you.